In this video, I'm going to show you how I have the client or patient apply the cuffs on the lower extremity, and just going to talk you through what's happening. So the first thing I'm going to have him do is place the 2-ply sleeves. You don't have to have these, but in a clinical or a gym setting, this keeps the cuffs cleaner and more sanitary. And then I can throw these into the wash, or you could have each individual client or patient have their own set. There's lots of different variations depending on your scenario, but I'm going to have him place these on. He's going to pull these up as high as he can on the leg. He's going to do this on both sides. And then I'm going to have him place the cuff on his right leg. He's going to cinch that up as tight as he can go. And that way, when we're inflating, we're consistent. So if you don't have those nice and tight, if there's a lot of slack in it, meaning I can get more than like one finger up in there, like I can get one finger in there, but I shouldn't be able to get two. That means that the cuff is on nice and tight. And that way, when I go to inflate, there's not a lot of slack in the system to start. So now this one is going to go on his left. And we want these little wings to be over the top, so I'll have you do that on the right side. And what those little wings do is prevent the cuffs from sliding under pressure. This will keep them right on top of one another. Now I'm going to have him inflate his right cuff to his predetermined percentage of limb occlusion pressure. So he's going to inflate this to 200 millimeters of mercury. Perfect. And then now I'm going to have him detach. He's going to attach it to this left one. He's also going to inflate that to 200 millimeters of mercury. And then to make sure that the cuffs are sitting well, I'm going to have him do a couple air squats. So he's going to sit down into his air squat. Good. And then come on back out. Then he's going to go back into that air squat again, and then come on out. And now we're going to retest the pressures, and we're going to retest to make sure that it's at the percentage of limb occlusion pressure that we initially started. Sometimes that little movement will adjust it, and he dropped a little bit, so I'm going to have you inflate back up to that pressure, and then you can detach. And then we're going to do it again on this left side. And then I'm going to have him inflate it. Oh, yeah, it needs a little bit, so inflate that up a little bit. Okay, great. And now he's ready to exercise. He's going to go through the exercise. Let's say he's doing an air squat. He's going to do his reps and sets. When he's ready to deflate, he is going to reattach the cuff on the right side and then release the valve. Okay, he could do the same thing on the left, or he can just press this little stem button, and that will also release air. If during the exercise he starts to feel too much discomfort, like above an 8 out of 10, or lots of numbness and tingling, then he could just hit this little button just once, and it'll release some of the air to make it more comfortable. But I try to keep the pressures consistent. So that's how to put the cuffs on, inflate them, exercise, and then deflate them.